My name is Bolu Ogunyemi. I need your help on my campaign for CMA President-elect. I moved to St. John's at age 3 with 2 parents with very humble beginnings in Nigeria. I understood from a very early age that grit, perseverance, and a vision for a better future can propel any unlikely journey. I completed medical school right here at Memorial, lobbying both the provincial and the federal government for increased resources for distributed medical education for medical students from rural areas. During my residency in Vancouver, I served as Director of Communications for Resident Doctors of BC. We spearheaded the largest Resident Awareness Week in Canada, highlighting the important role that resident doctors play in delivering healthcare in Canada. After serving as the National Convocation Speaker for the Royal College of Physicians and Surgeons, I returned to St. John's to begin a practice in medical dermatology and begin a regular visiting clinic to Labrador City. I've taken on a number of leadership roles at the university and in the community and have been promoted to a clinical associate professor of medicine. And I'll be ready to hit the ground running on day 1 as CMA President-elect. My leadership experience will be important in order to leverage the tremendous influence that the Canadian Medical Association can have on shaping health policy. I served as the inaugural Assistant Dean of Social Accountability at Memorial Faculty of Medicine and just the second person in Canada to have this role. I worked with many stakeholders, both within and outside the university, to design and implement initiatives in the areas of Indigenous health, global health, and health equity, advocating on 5 different provincial and national medical organizations, and serving on the Senior Management Committee of Memorial Faculty of Medicine. I've been working on the most pressing issues facing healthcare today. Let's face it, our healthcare system is in crisis, and we can't continue to keep doing things the same old way. We need a health human resources plan so we can have the right mix of doctors, not just for today, but in order to serve our communities in the future. We need to redouble our efforts in recruitment and retention of physicians. We need to create a system where we actually listen to doctors and find valuable incentives for recruitment and retention. With an ever-increasing number of unattached patients, both in Newfoundland and Labrador and nationally, now is the time for a major investment in primary care. This includes increased training of family physicians, increased recruitment and retention efforts, reduced administrative burden, and appropriate resources and remuneration. Doctors need to be at the table where any decisions are made that affect healthcare delivery. With my background in evidence-based health policy, communications, and senior leadership, I will ensure that our national organization is effective in improving the functioning of health systems. I need your help to support my campaign to be the next President-elect of the Canadian Medical Association, to advocate for healthier communities, better health outcomes, and a respected and united profession.